AZCCC presents the Cancer Care Podcast. Arizona Center for Cancer Care. Comprehensive care with the highest quality of cancer treatment in Arizona.
Today, we are joined by radiation oncologist, Dr. Luci Chen.
Dr. Chen, great to have you.
Thank you so much for having me, David.
All right, let's get going. So what motivated you to specialize in the care of cancer patients?
When I was in grade school, I had a friend who developed a bone cancer, and unfortunately, she eventually passed away of her diagnosis. So as a child, this left a really big impression on me, and I wanted to do more to help people with cancer. So when I went to medical school, I decided to specialize in the field of oncology or the study of cancer. And this field gives me the opportunity to help people be cured of their disease. Unlike other diseases in medicine, such as high blood pressure and heart disease, those aren't curable, but with cancer, we do have a good chance for curing them. I love the relationship that I develop with my patients and the fact that I see them during the time they receive the radiation, but also afterwards on follow-up for many years afterwards. So I develop a very close relationship with my patients. In addition, personally, my family has been touched by cancer. My father had prostate cancer at age 73 and underwent radiation treatments, and many years later, he's cured. I have a maternal aunt and a maternal cousin and a paternal aunt who all have had breast cancer, and they're survivors. So breast cancer and prostate cancer are the two most common diagnoses that we see in the United States, in addition to non-melanoma skin cancer. Receiving a diagnosis of cancer is definitely a life-changing event, and at first it can be very scary. But with modern treatment, we have been able to cure many more people today with many fewer side effects. So I'm very grateful to be part of a team of well-trained and compassionate doctors at Arizona Center for Cancer Care who strive to provide the best care for cancer patients.
What challenges do newly diagnosed patients face?
When someone receives a diagnosis of cancer, I think fear is the first emotion that many people experience. But there are emotional, physical, spiritual, psychological, and financial effects. Many patients have an overwhelming sense of loss of control. So a cancer diagnosis may be hard to understand, and medical treatment is often complicated. Doctors and other healthcare providers train for many years to become experts in their field, so patients have to place their trust in these experts. But this leads to an imbalance of a sense of control from the patient's perspective. They have concerns about what treatments are recommended, what side effects they may have with their treatment, and how these effects will impact their life during treatment and after treatment. So many patients want to find a plan to fight the cancer and try to get their lives back to normal as soon as possible. So the treatment team's job is really to give the patients clear information about what options they have and what the recommended treatments involve, and how this will impact their life during treatment as well as after. Patients do have a better outcome when they feel more in control, and we want to help them understand and agree to therapy that they are comfortable receiving so they feel that they are in control. With our team at Virginia Piper Cancer Center and Arizona Center for Cancer Care, we have social workers that provide emotional support, staff that help with spiritual and psychological support, and staff that answers questions about financial responsibilities. And if need, we can connect them to other agencies that offer financial support.
Describe the newly diagnosed breast cancer clinic that is being offered at Arizona Center for Cancer Care.
So the newly diagnosed breast cancer clinic is a new patient visit being offered to patients who have recently been diagnosed with breast cancer. So when a patient receives a new diagnosis of breast cancer, they may be frightened and in emotional distress. So my goal is to provide a physician visit as soon as possible after their diagnosis to help alleviate this stress and to answer questions about their diagnosis. Patients can call for a self-referral, or they can have their primary care doctor call to make an appointment. We will schedule them within 4 to 5 days of their calling for the visit, and oftentimes sooner. We will obtain their breast imaging report and review the images with the patient to explain the findings. We will review their biopsy report and explain what those results mean. and we can coordinate with any other doctor that they have been referred to for surgery or for medical oncology evaluation, and order other imaging tests like a breast MRI that might be helpful for their diagnosis before they see their surgeon. We can explain staging of breast cancer and provide an overview of the various types of treatments for breast cancer. Most patients will need to see a breast surgeon, a medical oncologist, and sometimes a radiation oncologist. We want to reduce anxiety for the newly diagnosed breast patients and provide as much information for them to feel in control of their diagnosis and help them understand their choices for treatment. We are here to support them along their journey to recovery. This clinic is available to patients either in person or by telemedicine.
So how has telemedicine contributed to caring for cancer patients during the coronavirus pandemic?
Patients with cancer are at higher risk for complications with COVID-19. Our goal is to provide healthcare in the safest manner, and for some patients, this is with telemedicine. We can use video and audio communication to safely visit with patients in their home or office. Telemedicine is also helpful when patients are elderly and are unable to travel outside their home. Being able to offer these visits ensures that we provide recommendations to patients in a timely manner and reduce their risk for exposure to the coronavirus. Some patients may have technical challenges, but we can offer a visit by phone without video and make sure that they are following treatment recommendations and answer questions about side effects. Some patients do need to come into the office for a physical examination, but for those who have medical conditions that do not require a physical exam, this is a very helpful way to offer care for patients. Some patients live quite a distance away from our offices, so telemedicine provides a way for us to provide care without concern for scheduling transportation. For some of the newly diagnosed breast cancer patients, telemedicine allows us to provide patients an appointment quickly with less disruption to their schedule.
What info do you want to give listeners regarding cancer treatment for breast cancer?
Breast cancer makes up about 15% of the nearly 1.8 million patients we will see in 2020 with cancer. The estimates from the National Cancer Institute Surveillance, Epidemiology, and End Results Program reveals that there will be about 279,000 cases of breast cancer in the United States this year. There will be about 42,000 deaths from breast cancer, which represents about 7% of all cancers. The relative survival rate at 5 years is 90%, which is very good, but for some patients, we need to do better. We know that about 12.9% of women will be diagnosed with breast cancer in their lifetime. In Arizona, the latest data available from 2017 shows that 4,754 women were diagnosed with breast cancer. Breast cancer usually involves 3 specialists for treatment: the breast surgeon, the medical oncologist, and radiation oncologist. Most patients will need surgery, and some patients may need either an estrogen-blocking pill or possibly chemotherapy. In the past 30 years, many new developments in surgery, medical oncology, and radiation oncology have refined the treatments and significantly reduced the side effects. Most surgery now involves minimal amount of tissue removed from the breast and minimal number of lymph nodes taken from the underarm. This leads to better cosmetic results, less recovery time, and fewer side effects. We now have tests to identify which patients will benefit from hormone therapy, chemotherapy, or both. Now there are biologic treatments that work to help with the immune system to fight cancer cells or control side effects from cancer treatment. We have clinical trials that offer new treatment options to test if they are safe and effective. Over time, some of these treatment options have become standard therapy to offer patients better cure rates with fewer side effects. Breast cancer is not one disease, so each patient's disease is treated with individualized care. At AZCCC, we work as a team to determine the best treatment for each patient and facilitate their journey to recovery and health.
Thanks for listening, and please join us again for the Cancer Care Podcast, presented by Arizona Center for Cancer Care. For more information on the highest quality of cancer treatment in Arizona, please go to ArizonaCCC.com.